always do. All right. So we have about 2 minutes, 1 minute left. So we'll just wait another couple of minutes.
Sounds good.
There is also, if you're interested at all in global health or any of the certificates that are under global health, which are program management, monitoring and evaluation and design for global health. It's got global health in the title. That's a functional certificate. The global health context certificate, infectious disease context for certificate, pharmaceutical context for certificate, and sex, sexuality, and gender. Those are all under global health. We organize them, but we're having an open house today with food. So you can come over to the Crosstown building if you want. That's 801 Mass Ave if you don't know the campus all that well yet. And it'll be in room 305. So I am really delighted to be hosting this first event or workshop in our public health writing series for, we always say that it's for new students, but this is actually something that is useful for me, who goes to one of these at least once a semester, because I always learn something and things are always changing a little bit. And so there will be a few more sessions like this next Thursday. This one will be completely focused on using the library resources and working on some of your search skills. Next week, Kristen and I on Thursday at 1 o'clock will be doing a session on paraphrasing and using Zotero. So using sources effectively and then citing your sources and managing your sources. And then the week after that on the 25th, that's also a Thursday at 1 o'clock, I'll be doing a session just more generally on public health writing and on resources that we have for you about writing here in the School of Public Health. And at some point, we will probably be doing a workshop that has to do with AI, using AI as a tool for when you are preparing to write or when you have written, and what's useful, what to do, what not to do, so that you can stay tuned for more information about that. But I'm going to go ahead and get started. So Kristen, thank you so much. I am delighted to introduce Kristen Sheridan, who is an education librarian here at the Alumni Medical,
Alumni Medical Library. There you go.
Alumni Medical Library. I should have written it down, even though I know what it is. But you know, when you're talking publicly in front of 7 other people, you always forget these things. The Alumni Medical Library, which, as all of you know at this point, is located at the top of the medical school building, and they have fantastic online resources. And Kristen is also within the library. There are different librarians who are special liaisons who have special roles and are connected to different schools here on the medical campus, and Kristen is our liaison. So I am going to hand it over to her because she has so much to talk about. Thank you very much, Kristen.
Of course. Thank you so much, Jen. Hi everyone. I'm Kristen Sheridan. Like Jen mentioned, I work at Alumni Medical Library. Don't let the name fool you. We serve the entire medical campus, not just alumni and not just the medical students. So you're all more than welcome to come. We are on the 12th and 13th floor of the instructional building, L building. I've heard it called many different things. As you will come to find, there are many things here in Boston that have multiple names and on this campus. So anyways, if you are on campus and you want to come over and say hello, or if you have any questions and want to meet with me, I'm more than happy to set up a time to do so. So I'm going to go ahead and start by sharing my screen, and I'm going to get started on our library website. So our library website is a different URL from the overall BU library. So here at Boston University, we are such a large organization. There are multiple smaller, what we call special libraries. So across town, they have the large, kind of all things library, MUGAR, which if you're over on Com Ave, you're more than welcome to use those spaces to study as well. All you need is your student ID and you're able to get in there, no problem. But they also have an education library, a business library, a theology library, a law library. So again, we're one of those small kind of special libraries here, and the library that supports the health sciences and medical programs and things, or excuse me, medical campus programs. So I encourage you to bookmark our website. This is one way you can very easily get in touch with us. So if you just Google BU Alumni Medical Library, we are the first option there. So I want to go over a couple of things on our homepage for you. Just point out some links and some kind of quick places that might get you where you want to go quickly. So like I mentioned, our medical library is right here. So if you get to this page, you're in the right spot. We do have these sliding announcements over here on the right-hand side. So these are just going to be, library hours, closures. We're doing a new thing called Resource of the Month. So you can check back every month and see what's new. This will just have any announcements or anything that's kind of going on here at the library. Up here in the top corner, this Ask a Librarian button, this is a great resource to remember. And if this is the one thing you take away from today, I hope it is this, that we are here to help. We're happy to help. You can always reach out with any question that you may have, whether it's getting started with research, getting started on, a search string to find articles for an assignment, or getting set up with a Zotero, citation manager, whatever it might be. We're more than happy to help, or also kind of be that first point of contact and then get you in touch with someone who can help you, because we know a lot of folks on campus that kind of specialize in different things, with writing and all those types of good things. So you can either send us an email, you can call us if you'd like, but this Ask a Librarian form is what I want to bring your attention to. So if you click this, it's going to pop you into this form. You can give us your contact information, the school that you're in, and what I think is really great is you can give us some days and times that you're free. I know that you're all so busy with your courses, maybe work, your personal lives. And so letting us know some days and times you're free, it cuts out that back and forth in the email of trying to, kind of secure that meeting time. And you can let us know if you want to meet over Zoom, if you want to come into the library in person, or if you have no preference and either work for your schedule. This also gives us at the library some opportunities to see the question and kind of gather some of the information before we meet. So we can just jump right in and know the right resources to get started with. So it's very helpful for us too if we have a little bit of a preview of your question. So this is a really great thing, and I'll show you where you can access that form on other pages as well, because we do have it. We do have it on many pages, which is good. So another thing I want to point out is some of our quick links right here on the home page. So for finding articles, we have PubMed, we have some of our top databases here, but we also have a bunch of other databases that are more subject or topic specific. So I might go into those a little bit more in depth in a later demonstration. Today, we're going to be looking at the website, we're going to be looking at a couple of our resource guides, and then we're going to be looking at PubMed, and then a newer database we have that it has policy and gray literature information. But again, I encourage you to take a look at all that we have to offer, because we really do have some wonderful resources and databases on that list. Another thing is our library search right here. So this is the BU Libraries catalog. So like I mentioned before, BU is a really large university and we have access to a lot of good stuff. Books, journals, ebooks, databases, videos, all of those good materials, and you can find them here. So this is another really great place to get started with your research if you want to see what we have here at BU. Another link I want to point out is this ILL, Interlibrary Loan. So Interlibrary Loan is a service that we provide. And so basically what that means is if you come across an article that you cannot find or have get access to through BU, if you fill out this Interlibrary Loan form, I'll go ahead and click this so you can see what it looks like. We'll click this form. Again, we'd ask for your contact information, your affiliation, and then if you could let us know the material that you need. So more often than not, it's a journal article. Um, so if you select this and give us as much information as you can, we'll work with our partner libraries that we share and borrow resources with and get that article for you, typically in PDF format, and it will be sent to your email. So this is a really great service we have, especially if you're, doing research where you might need articles in other languages or sometimes like really new articles. There's a bunch of different like kind of copyright and borrowing and sharing rules within academia, as I'm sure you may find out sooner rather than later. Unfortunately, we don't set a lot of those parameters. So there are times that journals only allow us, the last 6 months worth is not available and it's in what's called an embargo. So there's a bunch of different rules. I cannot keep track of all of them. So there are times where you may not be able to access something directly through BU, but you can request it here and we should be able to get access for you pretty quickly. So this is a really great service if you can't find an article. Okay, let me look at oh, great. Okay. So another thing I want to point out is our student resources. So this is going to bring us into the next piece of our website overview. So if we click on student resources, this is going to bring us to a landing page for the student portals. So a couple years ago, it was actually Jen and I worked to create the public health portal, which I'll show you in just a minute. But what I'm thrilled about is this actually kind of spurred us to make portals for each school. So all of our liaisons, like Jen had mentioned, I am the liaison to the School of Public Health, but we have other librarians that are liaisons to the other programs on campus. And so it's a great resource for us to have one link to share. We kind of think of it as like a one-stop shop, which is really helpful because there are so many resources out there and it can be overwhelming to know where to go and where to find them and kind of where and when to use them. So this particular resource guide, this public health portal, was designed with that in mind. So if we go ahead and open this up, we can see we've got that BU Libraries catalog, like I mentioned, interlibrary loan. We also have this research services. So again, that brings you to that Ask a Librarian form. So that is available on a couple of different spots. There's also this study space tab here. So here at the library, we have group study rooms as well as individual study rooms. So if you're looking to book a quiet space, you can do so with this. Where is it? I've got to move my Zoom people over here. Yeah, so this medical library space availability. So if you go ahead and click this, you can see all the red. Our study rooms are very popular. So if you're looking for a quiet space and you want to book one of these, you can do so with that link. And that's a really great place if you, again, need that quiet space for studying. I will say, though, the 13th floor here at the library is our silent study floor, and it is a really great place to study because it is very, very silent up there. So again, a couple of those resources right here for you as well. The Find Sources tab is one that has a lot of information for you. So we've got some of the top databases in public health research. If we scroll down a bit, you can see some of those, and I'll talk about these in just a minute, but these gray literature resources and databases that have a lot of really interesting documents and reports, things like that, that can be really hard to find in peer-reviewed literature and published literature. So these might be reports from organizations and IGOs, NGOs, things like that. We also have a tab here on books. This is not an exhaustive list at all. These are just some of the kind of core course titles and things like that. But you can also go and search in the BU Library's overall catalog if there is a textbook that you are looking for. And not even just textbook, we do have a lot of other books too that aim a little more towards nonfiction, and even some fiction books if you're looking for some leisure reading. We also have some of the top journals here in public health. So you can go directly to any of these journals if you want to see kind of what's new, what they're kind of publishing and talking about right now. There's also a tab here on health statistics. So again, sometimes statistics can be really difficult to find. And once again, none of these are exhaustive lists. There are many other places you can go to find statistics and other like recommended websites and things like that. But this is just a good place to get started and kind of jump into finding research. So I did separate these in more of like a local, so some local health statistics here in Massachusetts, and as well as some more national and global places that you might go to find statistics. Um, so this is a really helpful page too. Again, some recommended websites. So some of these are more general. So, we've got some CDC sites in here, WHO sites, things like that, some federal pages and whatnot. So again, this might be really interesting and have information you might be looking for. We also have some guides on various public health topics. So these might dive a little bit deeper into those specifics. For instance, epi and biostats. We have some other resources that look a little bit more at the epi and biostats and resources that you might be looking at to use in those disciplines. And then lastly, we also have some videos. So you can also go and look in our catalog for videos too. I know so much of your education right now is reading, and there's oftentimes you might just want to watch a video or maybe absorb information in a new way. Um, so Jove is a resource. It's a kind of educational visual education. I think it's the Journal of Visual Education. Everything's abbreviated, and I cannot keep track of what it all stands for. But this is a playlist that we've made with specific public health topics. Some are specific, some are a little bit more broad, but again, it's a really nice way to kind of take a break from reading and maybe absorb information in a new way. So moving on down the list, we've got some public health writing. So this is our citation information guide, which we'll spend some time on next week when we're looking at citation management tools and Zotero specifically. And we'll look at these things again next week. But it's also on this guide for you. Again, we wanted it to kind of all be in that one spot. So you just had the one link that you need to save or kind of be aware of. And I know that Jen did mention AI as a potential program for later in the semester. We did add this tab onto all of our student portals. So here at BU, they have created what's called Terrier GPT. So it's a more secured and BU approved LLM that you can use. So it's nicer because it doesn't go out into the World Wide Web that ChatGPT does. It's a little bit more internal here at BU. So that could be a tool you might be interested in using. There's also a group on campus called BU AIDA, the AI Development Accelerator group, and they're working on a lot of policies and procedures around using AI on campus. So if you're interested in kind of following up, as we know, AI has been evolving and changing sometimes daily. So this is a really great group to kind of keep the pulse on what's happening, not only here at BU, but also kind of across academia. They might have some information for you there too. And then lastly on this page, we did include the AI policy for the MD program. So while the School of Public Health, at least to my knowledge, does not have their own official AI policy, there could be one in the works right now, but we just wanted you all to have maybe a baseline to look at if you were interested. So I'll just pop this open really quick because what's really nice about this is um, many of you are doing research in the same type of area. You may be working with patients where there's more privacy concerns or there's more that you might need to consider in like a clinical reasoning kind of way. And so they've really mapped out what they kind of would see as a good use or a not so good use of using AI. So again, this isn't like, the rules that have to be followed. It's just more of a guideline. But if you scroll down a little bit, they have more in-depth information on their policy. But what I think is great is they've got this, the uses to enhance learning, They have, a couple of examples of how you could do so, and then some way or some uses that you may want to avoid using AI. So I don't think any of these would really surprise you, when there are times of critical thinking that you should be using, other resources, maybe the resources here at the library, that do in fact use like best practices in evidence-based medicine or things like that, rather than relying on an AI tool to kind of decipher or summarize something for you. So again, just something nice to kind of keep an eye on, and this does relate and is adjacent to some of the programs and education here on the other schools as well, not just the public health school, but also like the dental school. They use a lot of the same types of resources, but also work with similar populations. So just something to keep an eye on, and I hope that if the School of Public Health does release a policy for the school, that will update that here when that becomes available. But I would always double check with your faculty member. They may have something written into their syllabus. Sometimes they'll have uses for specific assignments. So I would really just check with them and make sure that you're following kind of their expectations for the course. Um, and again, these will be updated as new information becomes available, but this is, September 10th of 2025. This is what we have right now. So we also have some information on copyright and plagiarism, the Educational Resource Center, which is, I believe that's across town. But again, it can still offer some support, especially with writing. Unfortunately, we don't have the bandwidth at the library to help with writing, but that said, there are groups on campus that do help with writing, editing, revising. So the Educational Resource Center is one of those, as well as the peer coaches. So I'm hoping that you'll make appointments with the peer coaches and learn more about them, and I'm sure we'll kind of touch on that next week as well. So before we jump into the Writing Resource Center, I'm going to show that very briefly, and then we'll spend time on that next week. But we do have some videos and tutorials. So this tutorial is actually the one you're at right now, but just last year's version. So once this recording is up and ready for us, I will include the updated 2025 version of this recording, as well as the one that we'll be doing next week. So I'll have both of those, the new kind of updated version of those available to you as well. We do have a page here on course reserve. So if you're looking into any of the courses that you're in to see if any of the books are on reserve, that would be listed there. And then lastly, we have a page all about me, just a little bit, but so you can send me an email if you like. I'm happy to meet with you and go over any questions that you have about using library resources or getting started on assignments or whatever it may be. Okay, so let me pop into this Writing Resource Center. Again, we will spend a lot more time on this next week, but I just want you to know that it's there. And there's some really wonderful resources here on public health writing, as it's a very different style of writing than your traditional kind of maybe writing you did in your undergrad. There's a lot more paraphrasing, a lot less, block text, quotations, things like that. And I'm not the expert on that, Jen is, and so she'll definitely give you more information on that next week. But where I can help is where it comes to using and citing sources. So we have some more of that citation information here, and we'll dive into using Zotero next week. One thing I do want to point out is this really fun handout flyer that we made last year. So it's kind of a, don't do this instead. And so instead of using some of the AI tools that are available, maybe consider using some of the library resources that we have. Using something like Zotero to save and organize your citations. Use our research guides that we showed, and then when in doubt, let us know, send us an email. We're happy to meet with you. So I always like to point that one out because it's very fun. Okay, so let me see. I think that's what I have for our website and our guides. And I do see that there are a few questions in the chat, so I'll just pop in and make sure. I will actually talk about the use of Boolean operators today. Thank you. Um, yes, I can show the health statistics tab, no problem. Okay, so on the public health portal guide, they are listed right here. So in the find sources tab, um, here it's just a few places that you can go, but there are many other places you can go to get health statistics.
Thank you.
Of course, of course. All right. All right. So does anyone have any additional questions on either the website or the portal? I'm happy to answer any questions that you have. If you want to put them in the chat or unmute yourself and ask, that's fine too. But if not, I will go into the demo part of the day, which is going to be building a search in PubMed and then looking at the policy commons. Okay, well, let me jump into PubMed. And again, if any questions come up, just let me know. All right, so we do have PubMed listed right here as one of the first databases in our Find Sources tab. So we can go here and open up PubMed through the library website. I always recommend going to PubMed through the library website because if you can see, it's really teeny tiny up here in my URL bar, but I have an easyproxy.bu.edu listed there. So all that means is it's putting my computer on the kind of IP range of the campus. So when I go to PubMed, it's going to think that I'm on campus and it will have access, that remote access into library resources. So if you're at home, if you're off campus, going into any library resource through Alumni Medical Library's website is the way to go because it will just put you on that proxy and it'll save you time than finding something in PubMed and then having to search for it a second time in the catalog to get the full text. So there'll be a little Find at BU button available once we click into an article, and I'll show you what that looks like when we get there. But this is just a great and easy way that you can access things through right through BU's catalog. All right, so the question that I'm going to use today as our research topic is electronic cigarette or vaping use among adolescents. So a lot of times I'll come to PubMed and I'll just do a pretty basic search like maybe I would in Google. So maybe I'll go ahead and type in vaping adolescents. Look at that. Here we go. So if I search for this, I get kind of an error message. I definitely don't mean that. So I'm not really sure why they asked me that question. But we can see here, I do have a lot of results. And some of these look okay, right? You know, I can see adolescent, vaping, it's bolded in either the title or the abstract. So these aren't necessarily bad, a bad search or bad results, right? I'm sure if I needed just a few articles, I could likely find something with a search just like this. But if I go to the advanced search in PubMed will keep your search history for about 8 hours, which is really great while you're working on, you know, a search or while you're working on a project or assignment. But if I click in on the details here, this will show me what PubMed actually searched for. So again, not too far out of left field. They've searched for vaped, vaping, vapes. Then when we get to adolescence, they've kind of gone a bit rogue. They've added a couple different endings. They've also done adolescent space S, which I didn't type. So PubMed sometimes will separate your terms and search for things in a way that you may not expect. This often happens with like a phrase. So let's say community health, something like that. PubMed will search for community and health unless you put community health in quotation marks. So sometimes it brings your search a little bit out of scope. And even just to show you, because I just mentioned it, we'll see what that does. So if we search for community health, again, a lot of results, which isn't surprising. Community health is a very broad topic. But if we look at the advanced search of community health, we can see that it has found a mesh term for public health, which is great, but not necessarily what I was searching for. But it has also searched for public. It has also searched for health. It has also searched for community and health all separately, right? So again, this might be bringing my search a little bit out of scope. So what I want to do is use a combination of mesh terms and keywords to build my search. Has anyone, and I know I can't really see you all with the Zoom today, but has anyone heard of a mesh term before or used them in searching? Okay, so mesh terms are the controlled vocabulary that PubMed has created and kind of designed the database to be searched with. So if we scroll down a bit on the home page here, they've got this globe with a mouse and they have the mesh database. So MESH stands for medical subject heading. And again, it's just that controlled vocabulary that PubMed uses to index all of the articles that come into PubMed. So I like to think of MESH terms as almost a tag or something on an article because every article that comes in is indexed with these MESH terms. Sometimes they're super broad. They might be a MESH term for public health, or it might be a really specific term or a location, or so oftentimes it's the major topics of the paper, but sometimes some of those minor topics trickle in as well. Some papers have 5 mesh terms, some have 15. It really just depends on the article. And years ago, it was humans that would read every abstract title and they would assign mesh terms. Now it's more of an automated kind of AI way, which isn't necessarily a bad thing, but AI does tend to miss some of the nuances of understanding the full scope of a paper just from the abstract. So I do find that sometimes the mesh terms aren't always as accurate as they could be. But that is why using the mesh term and a keyword is a really great way to comprehensively search in PubMed because it allows you to still look for things in places other than the mesh field. So with that said, I'll get started with my search here. And maybe I'll just search for smoking to start, just so I can show you many results in a search. So we can see that we've got smoking right here. They'll include the definition of that term underneath, which is really helpful. But it does get a little more specific. So sometimes they've got specific agents, they've got specific kind of types of smoking, whether it's tobacco smoking, marijuana smoking. Sometimes you may be looking specifically at one type of smoking versus another, or you only want marijuana smoking, you don't want tobacco or any other kinds of smoking. So if we scroll down a little bit, we can see all of these different types of smoking. And then it gets a little bit more kind of adjacent, right? So then we've got tobacco control, which is part of smoking prevention. So we can kind of see how this evolves to be a little bit kind of adjacent to the term that we might have searched for. If we look next, we can see they have a couple other smoking things as well. But since I'm looking for vaping, I might do another search to see if I can find something a little bit closer to what I'm looking for. So if I search for vaping, they do have a vaping mesh term, which is great. So if I click on this, again, I'm going to see that definition of the term, which is great, and it will help me understand that I'm using the right term. For me as a librarian, this is a really helpful part of the mesh database because I'm not a subject expert. I can help you build the search, but I don't always know, is this the right term? Are they looking for this specific type of smoking or is this not right? So it's very helpful for me, and I would imagine when you're working in a new topic and you're not as familiar with the terminology, the literature, this is a really helpful way to make sure you're on the right track. If we scroll down a little bit, this is what one of the records looks like here. So as we can see, there are a lot of entry terms. So these entry terms are just basically synonyms of vaping. So like we can see here, we've got e-cigarettes, electronic cigarettes, vaping, vapes, anything that's a synonym of vaping. If we scroll down a bit more, we can see that it was previously indexed as another term. So it was previously indexed as just smoking, and then it was indexed as electronic cigarettes. And now I think vaping has become the term, right? As we all know, terminology evolves and changes as new things are introduced and old things become old things. And so the mesh database does do its best to kind of stay with the current kind of terminology of things, but they will let you know if a term has been updated in recent years. So we can see here, the last thing I want to point out is this mesh tree. So this is really helpful because it shows you very like broadly where the tree kind of starts. And then as you move down the tree, it gets more specific. So like we had just seen with smoking, that is a broader term where vaping is a type of smoking. So you can kind of see how that tree might work a little bit. But again, vaping is the term that we want to use for today. So what I'm going to do is now I'm going to start building my search, and we can do that right here. So I'm going to go ahead and click this add to search builder. So what this does is it takes this mesh term, it puts quotation marks around the term or phrase, and then it puts this mesh bracket afterwards. So this is telling PubMed, I want you to search for every article that has vaping as a mesh term. So it's only searching that one field though. So this is where I want to build that search in a comprehensive way. I'm going to continue my search. I'm going to type in or, and this is where those Boolean operators come into play. I'm going to retype my word or phrase here. I know this feels a little silly, a little redundant, but I promise you there is a method to the madness. By typing or and then retyping the term, I'm now searching for this as a keyword. And the keyword search searches all other fields, including the title and the abstract. So this is telling PubMed, I want you to search for vaping in the mesh field. This is all in the back end stuff. You all don't need to worry about this. But this is searching the title, the abstract, maybe the journal. It's searching all other fields. So what I like to do at this point is this is where I like to add any synonyms. So this is where or comes into play. So the three Boolean operators in searching are and, or, and not. So we like to use or when we're putting together similar concepts or synonyms. I like to think of or as more. The more like terms or synonyms that you can put together, the broader your search will be. So in this case, I chose this question specifically because the two concepts we're looking at, there are a few ors that we can put here, right? We can do or vape or electronic cigarette or e-cigarette, right? So it's up to you as the researcher how many synonyms you want to put in here. I like to think of it as whatever word you'd be happy to come up in your search, right? Um, you know, if the word vaping came up, great. If electronic cigarette came up, excellent. If e-cigarette came up, wonderful. So it's one way that you can just really expand that search and get as much literature back. So I hope that made sense. Does that help at least with the first part in the first Boolean operator? We'll kind of see how it all comes together in a beautiful search. But for now, this is just one of our strings. So I'm going to go ahead and click Search PubMed. And again, this is going to be a lot of results. That's okay. The next piece of our question is our population, which is adolescent. So I'm going to go back to the home page of PubMed, and I'm going to go back over to the mesh database. And this is where I'm going to look for my next concept, which is my population. But this is the same process of if you were working on any research question. You could go and build your search concept by concept and then add them all together at the end. So what I want to do now is I want to go ahead and look for my population, which is adolescent. And we can see here that there's a couple adolescent terms, which is really interesting. Some are looking at, specific health services, psychology, medicine, behavior, all these things. But I'm going to go ahead and do the broad adolescent because I want to look at a person from 13 to 18 years of age. If we scroll down a bit, again, same thing. We've got all of those keywords. And we can see in that tree of terms that adolescent fall underneath persons and age groups. So I'm going to go ahead and build my search in the same way. I'll add to search builder. It will add my term there with the quotation marks and with the mesh. I'll type in or adolescent. And this is where we can have a little bit of fun, right? We can do or teen or teenager. I would imagine if you work with teens, you probably don't say, oh, I teach adolescents or I work with adolescents. You probably say, I work with teens, I work with young adults, I work with youth, whatever it might be. So this is where you can kind of be creative and add in any term that you think would fit this population. So yeah, we have youths, teens, teenagers, all of that good stuff. And again, you can expand this however you want and however you see fit. But let's go ahead and search PubMed for that. And what's really great about those keywords is a lot of times if you are out in the field or you're a practitioner, you might know some of those terms that people use on the floor or out in the field or on the fly, and you can add those terms in because they might be more of like, the vernacular of that discipline or whatever it might be. You might know some of the terms that researchers are putting in and their own keywords, or maybe would be included in an abstract, but not necessarily the title, whatever it might be. So the more experience you have in that area, the more keywords you might just know off the top of your head. You also may discover some keywords as you look through the literature and say, oh my God, I didn't even think to add teenager to my search. I should add that, something like that. You don't know what you don't know. So sometimes these initial searches can really help bring back some keywords that make sense. So what I'm going to do now is I clicked into that advanced search. I'll do it again. I'm sorry, I do it very quickly. It's like muscle memory for me at this point. I'm going to go ahead and click the advanced search. And like I mentioned, my search history will be here for 8 hours. So now I want to use my second Boolean operator and add these two different concepts together with and. So what I'm going to do is go to my first search string that I have for vaping. I'm going to, under this action column, click these 3 dots and then click this add query. So that's going to take that search I've already done, put it up here in this query box. And now what I want to do is I'm going to click those same 3 dots for the adolescent string, but now I have a few new options. So I have a few operators that I can choose from. So in this case, I do want to select add with and, because when we're looking at 2 different concepts, we want to put them together with and. When we're looking at the similar synonyms, same type of concept, we would use or. And when we're not looking for something, we'll add not. So I would be a little cautious using not. I would hate for you to limit your search and it would remove something that you actually would be interested in. So I know a group I worked with, I believe it was last summer, they were looking into like the flu, influenza, things like that, but they did not want any COVID literature. So in that sense, not is a great term because it would remove all of the articles and things that were focusing on COVID and not just, the seasonal flu. So sometimes those types of times you might use not, and you can easily justify in like your methods or in, wherever you're kind of explaining your search terminology. If you need to report on that, you can say, oh, we'd used not in our search because we wanted to exclude or remove any research on X or something like that. But for today, we're going to stick with or and I'll go ahead and click and it will populate that search box for me. It will put each of my search strings with parentheses around it, and then it'll put that and in the middle, and then my population of my adolescent. So I'm going to go ahead and click search now. So now I have some more results. In my first search that I had done, if we look in that advanced search again, we can see that I had about 3,000 results just by looking at vaping in adolescent. But now, since I've used some of that controlled vocabulary as well as teenagers, teens, youth, vaping, vape, electronic cigarettes, I have a lot more literature that I can look at now. And I know that, almost 5,000 results is still a lot to look through. So some filters that you can use that might be helpful. A lot of times folks are really only looking for maybe the last 5 years of literature, sometimes even the last 1 year. So you can really quickly filter down. Let's just pick 5 years for now. So that cuts our results in about half. If we scroll down a little bit more, maybe we want to look at a specific article type. Maybe we want to look at a specific, maybe male versus female. They also do have some age filters here. So we could take it a step further and select the adolescent filter, which I would hope would not change the results too much. Okay, it didn't really. Luckily, that's sometimes there are articles that look at a wide variety. So they might look at adolescents, but they also may look at adult populations. So I would hate to have removed a paper, although it did touch on adolescent, anyways. But those are just some filters that you could use. they will follow you. So until you click clear all, if you do another search on a completely different topic, it will keep the last 5 years and the adolescent age group. And it will stay here in the green bar. So you'll know to remove it if you need to. But let's just say this particular article, this is from September 2025. So this is a pretty very new article. I shouldn't say it's pretty new. This was published 2 days ago. So very, very new. And so when we get into PubMed, this is what one of the article records looks like. So we've got all of our publication information right here. We've got the title, we have the authors, we've got the abstract. And if we scroll down a little bit, we can see those mesh terms. So this is great that this one already has mesh terms. This one they're looking at adolescent. They also have child, delivery of healthcare. They have smoking cessation as well as vaping. So maybe, our search had about 3,000 results. Maybe we're really interested in specific programming or, interventions on smoking cessation. We could add that to our search, so you don't always know the right terminology until you find an article or you really hone in on your topic and make it a little more specific. And that's what we're here at the library to help you with. So I know this was a really quick and broad example of using PubMed, but the more you use it, it's just like a muscle you need to work. The more you use it and the more you come in here and try searches and maybe fail at a search and you try and try again, you will find the keywords and the terminology and stuff that you need. Yes, I see a raised hand. Is it Mary Joy? I don't think your volume's working. I can't hear you.
I can't hear you either.
What about now?
Oh, yes.
Okay, what am I think I need to increase this. So okay, my question is regarding to the year of production, or publish of the when an article is being published. Is there a kind of a restriction in BU? How far back are we free to cite up an article in our research papers? Because I'm asking this because from undergrad, I know that we were restricted to take from 10 years old papers and nothing far back than that because of the fact that there are newer research that comes up and because of their evidence and so on. So are we restricted in BU or can we just take something from 1980 something, for example?
Yeah, I mean, there's no universal restriction to my knowledge. I would definitely check with your faculty member because I think it really depends on the topic that you're searching, really.
Okay.
But
Yeah.
Jen, you might have a little more
I
context.
was, just going to jump in and say, I think that in your ICPH class, which is PH 720, I do believe that you, for the big project that you work on, you're only supposed to go back 5 years because they want you to find the most recent stuff. But usually your professors will let you know. What we want to make sure is that you're seeing the most relevant and recent stuff, but that doesn't mean that there are things that from the 80s or the 60s that aren't useful and foundational. So I would say just, pay attention to what's written in the assignment and the syllabus. And if you ever have a question about whether or not you can use a source, then ask your professor. They'll be happy to let you know.
Okay. A second question. Our search terms, are they in any way related to our methodology? Are we to document them anywhere, or how important are they, or are they just for the sake of the search process?
Yeah, that's a great question. So it really depends on the assignment and type of review that you're working on. So if you are just, finding a few articles for a discussion post, you likely don't have to relay your search terms. But if you were working on a more comprehensive review or evidence synthesis-based research like a systematic review, you would have to report the exact search that you did. And the reason for that is because with the rigor of those types of reviews, you don't have to worry about those right now. You're not being, that asked to do anything like that. But the idea with those types of reviews is that every search should be reproducible. So if I, write this paper and I did this specific search, you could theoretically copy that search and get the same results that I did. Although I might have other parameters and I might have excluded certain papers because it didn't meet my research needs at that time, you could still find the articles that I found with that search. So you often don't have to report on your methodology. It's really only in specific instances for papers like systematic reviews or scoping reviews.
Okay, thank you. Now, the last question. How can we find the level of evidence through each paper and article? Because I believe that there are different, depending on if it is an article or journal, they have different level of evidences, right? Is there anywhere that these are classified if I am looking at an article or journal?
I don't believe they're classified in that way. What do you mean by level of evidence? Do you mean?
I can remember, for example, from our ICPH classes that, for example, systematic review are being considered as the lowest in evidence, and it goes down to descriptive or qualitative study, for example. And my question is, do I have to read through the lines to know if, for example, an article is a systematic review? That means it has a lower evidence rate in compared to a qualitative study, which has probably a higher evidence rate? Or is it somewhere in the article where I can see them very fast?
It oftentimes a scoping and systematic review will have that listed in the title. It should. There may be specific keyword, it might be listed here as a mesh term. Sometimes, depending on the article, they may have the kind of review type here, but I would likely recommend reading within the abstract or maybe even the full text to find out that information.
Yeah, and I would say that, for ICPH, very specifically, you're not supposed to, in your original, sort of round of research, I think for the DNS, I don't know if that's what you're still calling it.
Exactly. Yes.
Strategies assignment. You're not supposed to use reviews because they want you to find individual studies. Reviews are fantastic. You look for them, use them, read them, include them, but they, for kind of addition, the original kind of round of research, they want you to find it specific studies. So like Kristen said, you really just have to read the title and the abstract, and that will clarify, whether it's qualitative, whether it's a randomized control trial, et cetera, et cetera, et cetera. So you do need to do that level of reading. There's not like some kind of number system that I know of.
They do have a filter. If you go back to the search results, you can filter by
yeah.
article type. So if you were looking for RCT or, something like that, if you look, they also have the see all. So I don't know what they've cut off after a few there. But if you click here, you could look at you can select and check as many boxes as you like here. So
yeah, that's great. That helps me.
So this will be helpful, but I would always double check within the abstract that it does in fact meet that methodology. Sometimes it could slip through the cracks or maybe be misaligned, just so for your own sake, just double checking that it does in fact follow the methodology you're looking for.
Okay.
But that's one way that you can use that filter in PubMed.
So it's actually 1:52.
I know.
We have this scheduled only until 1:50. I am able to stay on for a few minutes for if people have questions. And I just want to thank you so much, Kristen, for giving us this taste of PubMed. And as Kristen said early on, one of the things we hope you take away from this session more than anything else is that there are really nice people working at the library. She might not have said that, but it's true. They're some of my favorite people on this campus, and they are more than willing to help you. So, there are so many nuances to all these different kinds of searches, and they're willing to help you. So, use that tool to schedule an appointment. And you can see just from what Kristen has up here from the library, there are all sorts of other different kinds of databases. There's Web of Science and so many others, and Google, and
Yeah.
so if you want some more information about how to use those tools effectively, that's also a great kind of reason to connect with them and make an appointment. So does anybody have questions for Kristen before we log off? All right. I always want to wait through the uncomfortable silence, just if somebody's shy. But please do reach out to Kristen. I don't think I introduced myself at the beginning. I'm Jennifer Beard. I'm a professor in the Department of Global Health, and I'm also the director of the writing program here at the School of Public Health. So as we mentioned, there's going to be a workshop or another training session like this next week on using sources and citing sources and using Zotero to manage your sources. That will be Thursday at 1 o'clock. And then there's one the week after that is more very specifically about what makes public health writing a bit different from other writing that you've done in the past, and what are some of the resources that we have for you here at the school. So I will be taking this recording and distributing it through my various channels, but you're more than welcome to just shoot me an email at jenbeard@bu.edu. It's just I'll put it right here. And I'll be happy to send it to you directly too. So thank you so much, Kristen. This was wonderful.
Thanks so much.
Thanks to all of you for joining us, and we hope to see you next week. Bye-bye.
Well, thank you. Bye-bye.
Oh, I can stop recording.